my name is Heather Bridgeford. I'm a nurse practitioner here at Urology San Antonio, and I'll be talking to you today about pessaries. A pessary is a medical-grade silicone device that is used to support vaginal prolapse. A vaginal prolapse is a weakening in the vaginal muscle that allows the bladder and sometimes the uterus to hang below where it's supposed to be. When that happens, it can cause a lot of pain. It can also cause urinary discomfort. So when a woman comes in for a pessary, there's some measurements that need to take place in order to ensure that that device is right for her. The goal of the pessary is to support the bulge and push it up where it's supposed to be, and therefore improve her pain and her urinary function. A pessary, when it's the right pessary, should be comfortable, should not cause any pain, and should most of the time will improve urinary function. Once we find the right pessary that's comfortable for the patient, it's meant to stay in to support the prolapse, but it does need to be taken out occasionally to be cleaned in order to prevent complications. On average, it needs to be cleaned anywhere from every 2 to 4 weeks, but that really depends on whether the patient's going to be taking care of it themselves or not. Most women can come into the office to have the pessary cleaned. Otherwise, we can teach the patient to clean it themselves. And all of those options will be talked about at the visit to come up with a plan that's most comfortable for the patient. As long as the maintenance of that pessary is maintained, then the complications are minimal. There are problems that can arise with the pessary. Again, if the maintenance is not maintained, there can be irritation to the vaginal lining, sometimes bacterial infections. But again, if the patient maintains follow-up, then those complications are minimal. Using a pessary is a safe option that can be an alternative to surgery. So the two options for treating a prolapse are going to be a pessary or surgery. Using a pessary is a safe alternative to surgery. However, not everybody is a candidate for a pessary. Sometimes the prolapse may be more severe and we're not able to find an option for a pessary, and so therefore you can be referred to a surgeon that can help talk about surgical options with you. Also, the pessary can be used temporarily, and so if you're not ready for surgery right now, or if there's a certain circumstance where you cannot have surgery at this time, pessary can be used temporarily until you get to a date when you can have surgery. And at that time, the pessary can easily be removed, and then you can move on to your surgery. If you've been diagnosed with a vaginal prolapse and you think you may be a candidate for a pessary, please feel comfortable coming into our office so we can talk with you about when a pessary is used and if you're a candidate for that. And if you're not, we're likely to be able to find somebody that can help you.